We have a graphic here that talks about the cycle of addiction, because what happens is you get into it, you move, and this doesn't seem to stop. How do you break this?
Well, that's right. And addiction is a brain disease. So we have to first step back and look at that. We know that for many people there is this cycle of relapse. So as the graphic shows, often someone might be sober, staying in abstinence, and then experience a trigger, whatever it might be, being served alcohol and not being able to say no if alcohol is their drug of choice. And then tempting thoughts to kind of continue the drinking, relapse, and then it becomes, again, back in that cycle of using the substance and then having such guilt, such shame, and that's the problem we see with substance abuse. People often see it as a moral failing or their own fault, and so they don't seek out the right treatment. And because addiction is a disease, there are treatments that work, and so it's important that people don't just try to white knuckle it, as we say, or get through it themselves. They can come in for treatment and get better.
Is it fair to say that out of that whole cycle graphic that we just saw, if there's one word in there that I caught that as a psychiatrist you have to deal with, would it be triggers more than anything else? Or because it would seem to me that that's the point of the brain disease. Everything along this line, there's a trigger that will start everyone into motion. Yes, or am I overestimating?
You're right, and the treatment is behavioral therapy, cognitive behavioral therapies, we know work. And so it's important, as I said, there are treatments. Some of that involves medications. As a psychiatrist, we have many medications to help people with their cravings so that if they're exposed to a trigger, they're on medication that will allow them to manage those cravings so they have less cravings. And then the therapy, and that takes a long time for people to keep working on their what we call coping skills. So if they're exposed to a trigger, they know how to manage it and say no.